Between ages 60 and 90, your cancer risk increases exponentially. According to the National Cancer Institute, approximately 60% of all cancers are diagnosed in people over 65, and 70% of all cancer deaths occur in this age group. This isn't just because older adults have lived longer. Fundamental biological changes after 60 dramatically increase cancer development risk. Cells accumulate DNA damage over decades. DNA repair mechanisms become less efficient. Immune surveillance, detecting and destroying abnormal cells, declines. Chronic inflammation increases, promoting cancer growth. What makes cancer particularly deadly in this age group is late diagnosis. Research published in JAMA Oncology examined why cancers are frequently diagnosed at advanced stages in older adults. Studies found that in over 65% of cases, patients experienced warning symptoms for 6 months to 2 years before diagnosis. They noticed symptoms but dismissed them as normal aging, arthritis, digestive problems, or other benign conditions. By the time they finally sought medical attention, the cancer had often metastasized to distant organs, dramatically reducing survival rates. The difference between early and late diagnosis is profound. Many cancers detected at stage 1 or 2 have 5-year survival rates exceeding 80 to 90% with treatment, but the same cancers diagnosed at stage 4 after metastasis have survival rates below 20%. Early detection literally means the difference between cure and death. In this video, we'll examine 10 warning signs of cancer that should never be ignored after age 60. Number 7 is so subtle that people experience it for years without connecting it to cancer. These signs can indicate various cancer types, including lung, colon, breast, prostate, pancreatic, and others most common in older adults. Before we begin, understand that experiencing 1 or 2 symptoms doesn't necessarily mean you have cancer. Many conditions cause similar symptoms, but persistent symptoms lasting more than 2 weeks warrant immediate medical evaluation. Early detection saves lives. Now let's examine the warning signs your body sends when cancer may be developing. Sign number 10. Unexplained weight loss exceeding 10 pounds in 3 to 6 months without trying. Starting with one of the most significant cancer warning signs, unintentional weight loss after 60 demands immediate investigation. Here's why this happens and what it means. Cancer causes weight loss through multiple mechanisms. Rapidly growing tumors consume substantial calories and nutrients. The cancer essentially steals energy from your body to fuel its growth. Additionally, many cancers release substances called cytokines that suppress appetite, increase metabolism, and cause muscle and fat wasting called cachexia. Certain cancers are particularly associated with weight loss. Pancreatic cancer causes weight loss in over 80% of patients, often as the first noticeable symptom. Lung cancer causes weight loss in 60 to 70% of cases. Stomach cancer, esophageal cancer, and colon cancer frequently cause significant weight loss. Lymphomas and leukemias can cause weight loss along with other symptoms. Research from the Journal of Clinical Oncology examined unintentional weight loss as a cancer indicator. Studies found that in adults over 60 presenting with unexplained weight loss exceeding 10 pounds over 6 months, approximately 20 to 30% were diagnosed with cancer after comprehensive evaluation. The cancers were often at advanced stages by the time weight loss became noticeable. What makes weight loss particularly concerning is that it often indicates the cancer has been growing for months or longer. Early-stage localized cancers rarely cause weight loss. By the time you've lost 10 pounds without trying, the tumor is typically substantial or has spread to multiple sites. The key is recognizing unintentional weight loss. If you're deliberately dieting or have increased exercise, weight loss is expected. But if you're eating normally, haven't changed activity levels, and are steadily losing weight week after week, this requires urgent evaluation. Don't attribute it to stress, aging metabolism, or other benign causes without getting checked. What you must do if experiencing unexplained weight loss is schedule comprehensive medical evaluation immediately. Your doctor should perform thorough physical examination, extensive blood work, including complete blood count, comprehensive metabolic panel, and tumor markers, and imaging studies. CT scans of chest, abdomen, and pelvis can detect many common cancers. Depending on symptoms and findings, additional tests, including colonoscopy, upper endoscopy, mammography, or PET scans may be needed. Sign number 9. Persistent fatigue that doesn't improve with rest and interferes with daily activities. Moving to a symptom often dismissed as normal aging, profound persistent fatigue can indicate cancer. Here's the mechanism. Cancer-related fatigue is distinctly different from normal tiredness. It's overwhelming exhaustion that doesn't improve after sleeping or resting. You wake up tired. Simple activities like showering or preparing meals exhaust you. The fatigue interferes with your ability to function normally. Cancer causes this profound fatigue through multiple pathways. Anemia from chronic bleeding or bone marrow involvement reduces oxygen delivery to tissues. Your body's immune response to cancer causes release of inflammatory cytokines that promote fatigue. Cancer disrupts normal metabolism and hormone production. Tumors can cause pain that disrupts sleep. Anxiety and depression related to undiagnosed illness worsen fatigue. Research from cancer examined fatigue in patients later diagnosed with cancer. Studies found that 40 to 50% of cancer patients experienced significant fatigue for an average of 4 to 6 months before diagnosis. The fatigue was severe enough to limit work, social activities, and self-care, but was often attributed to aging, depression, or chronic fatigue syndrome rather than cancer. Certain cancers are particularly associated with profound fatigue. Leukemias and lymphomas cause fatigue in over 80% of patients, often as the primary presenting symptom. Colon cancer frequently causes fatigue from chronic blood loss leading to anemia. Lung cancer, pancreatic cancer, and kidney cancer commonly cause severe fatigue. What distinguishes cancer-related fatigue from normal tiredness is its severity, persistence, and lack of improvement with rest. Normal tiredness from insufficient sleep, busy schedules, or mild illness improves noticeably after adequate rest. Cancer fatigue is relentless and disproportionate to activity level. What you must do if experiencing persistent, severe fatigue is seek medical evaluation. Your doctor should check for anemia with complete blood count, assess thyroid function, check kidney and liver function, and screen for other causes. If basic testing doesn't reveal an explanation and fatigue persists, more extensive cancer screening is warranted. Sign number 8. Changes in bowel habits lasting more than 2 weeks, including constipation, diarrhea, or changes in stool appearance. Persistent changes in bowel habits can indicate colorectal cancer, one of the most common and deadly cancers in adults over 60. Here's why this happens. Colorectal cancer develops as tumors grow inside the colon or rectum. These tumors disrupt normal bowel function through several mechanisms. A growing tumor physically narrows the colon, slowing stool passage and causing constipation. Tumors irritate the colon lining, triggering increased contractions, causing diarrhea or frequent bowel movements. Tumors bleed, mixing blood with stool. The specific symptoms depend on tumor location. Right-sided colon cancers in the ascending colon typically cause diarrhea and anemia from occult bleeding. The stool may appear dark or tarry from digested blood. Left-sided cancers in the descending colon and sigmoid commonly cause constipation, narrow stools, and visible bright red blood. Research from the British Journal of Cancer found that 60% of colorectal cancer patients experienced persistent bowel habit changes for an average of 8 months before diagnosis. Many attributed symptoms to hemorrhoids, irritable bowel syndrome, or dietary changes, and delayed seeking care. What makes bowel changes particularly significant is their persistence. Temporary changes from dietary indiscretion, stress, or minor illness resolve within days. Changes persisting more than 2 weeks without obvious explanation require investigation. Additionally, watch for narrow, pencil-thin stools indicating significant obstruction, alternating constipation and diarrhea, or feeling of incomplete evacuation after bowel movements. What you must do if experiencing persistent bowel changes is schedule colonoscopy. Don't accept reassurance that it's hemorrhoids or irritable bowel syndrome without colonoscopy to visualize the colon directly. Colonoscopy can detect polyps in cancers, and polyps can be removed during the procedure, preventing cancer development. If you're over 60 and have never had colonoscopy, this is urgent regardless of symptoms. Sign number 7. Persistent cough or hoarseness lasting more than 3 weeks, especially in current or former smokers. This subtle symptom is often dismissed as a lingering cold, allergies, or bronchitis, but can indicate lung cancer or throat cancer. Here's the mechanism. Lung cancer growing in airways or lung tissue irritates tissues, causing chronic cough. The tumor may partially obstruct airways, causing cough reflex. Lung cancer can spread to lymph nodes in the chest that press on the recurrent laryngeal nerve controlling vocal cords, causing persistent hoarseness. Throat cancers, including laryngeal cancer, directly affect vocal cords, causing hoarseness that progressively worsens. Unlike hoarseness from laryngitis that resolves in 1 to 2 weeks, cancer-related hoarseness persists and gradually worsens over weeks to months. Research from CHEST examined cough as a lung cancer symptom. Studies found that persistent cough was present in 50 to 70% of lung cancer patients at diagnosis. Most patients had experienced the cough for 3 to 9 months before seeking care, attributing it to smoking, allergies, or repeated respiratory infections. What makes persistent cough and hoarseness particularly concerning in people over 60 is the high prevalence of smoking history. Lung cancer is the leading cause of cancer death, killing more people than colon, breast, and prostate cancers combined. Approximately 85 to 90% of lung cancers occur in current or former smokers. If you have a smoking history and develop persistent cough, lung cancer must be ruled out. Additionally, changes in cough character are significant. If you've had a chronic smoker's cough for years and it suddenly changes in quality, becoming more frequent, producing blood-tinged sputum, or causing chest pain, this indicates something new has developed. What you must do if experiencing persistent cough or hoarseness is see your doctor promptly. Evaluation should include chest X-ray at minimum. If X-ray shows any abnormalities or you have high risk factors, CT scan of the chest provides more detailed imaging. Chronic hoarseness requires examination by an ear, nose, and throat specialist who can visualize vocal cords directly with laryngoscopy. Sign number 6. Blood in urine or stool, even if it occurs only once. Blood appearing where it shouldn't be always warrants investigation. Here's why. Blood in urine, called hematuria, can indicate bladder cancer or kidney cancer. Bladder cancer causes bleeding because tumors growing on the bladder wall have abnormal, fragile blood vessels. Blood in stool can indicate colorectal cancer. Colon tumors bleed as stool passes over them. Many people dismiss these symptoms. They attribute blood in stool to hemorrhoids without getting evaluated. They notice blood in urine once, then when it doesn't recur immediately, they forget about it. This is dangerous because cancer-related bleeding is often intermittent. The tumor bleeds, then stops, then bleeds again days or weeks later. Research from JAMA examined hematuria in adults over 60. Studies found that among patients over 60 with gross hematuria, visible blood in urine, 20 to 25% were diagnosed with bladder cancer. Even microscopic hematuria detected only on urine testing carried 5 to 10% cancer risk in this age group. For blood and stool, studies show that among adults over 60 with visible rectal bleeding, 10 to 15% have colorectal cancer and 30 to 40% have precancerous polyps requiring removal. The blood may be bright red, maroon, or black and tarry depending on where bleeding originates. What makes blood and urine or stool absolutely critical is that even a single episode requires complete evaluation in people over 60. Cancer doesn't bleed continuously. A single episode of painless hematuria could be the only warning before a bladder cancer grows larger. A single bloody bowel movement could indicate a colon cancer that will metastasize if not treated. What you must do if you see blood in urine is schedule evaluation with a urologist. Evaluation includes cystoscopy, inserting a camera into the bladder to visualize the lining directly, and imaging of kidneys with CT scan or ultrasound. For blood and stool, colonoscopy is essential to examine the entire colon. Sign number 5. Persistent difficulty swallowing or feeling of food getting stuck. Progressive swallowing difficulty, called dysphagia, can indicate esophageal cancer or stomach cancer. Here's the mechanism. Esophageal cancer grows inside the esophagus, the tube connecting throat to stomach. As the tumor enlarges, it progressively narrows the esophageal opening. Initially, you may notice solid foods like meat occasionally getting stuck. Over weeks to months, swallowing becomes more difficult. Eventually, even soft foods and liquids are hard to swallow. Esophageal cancer typically develops after years of chronic irritation. Risk factors include chronic acid reflux causing Barrett's esophagus, smoking, heavy alcohol use, and obesity. The cancer usually develops in adults over 60 with peak incidence in the 70s. Research from gastroenterology found that progressive swallowing difficulty was the presenting symptom in 90% of esophageal cancer patients. Unfortunately, by the time swallowing difficulty develops, the tumor has typically grown quite large. Most patients had symptoms for 3 to 6 months before diagnosis. What makes dysphagia particularly ominous is that early esophageal cancer rarely causes symptoms. By the time you notice food getting stuck, the tumor has narrowed the esophagus by at least 50 to 60%. This often means locally advanced disease. What you must do if experiencing progressive swallowing difficulty is seek evaluation urgently. Upper endoscopy, inserting a camera down the esophagus into the stomach, allows direct visualization and biopsy of suspicious areas. If esophageal cancer is found, staging with CT and PET scans determines extent of spread. Sign number 4. Persistent indigestion, abdominal pain, or feeling full after small amounts of food. Vague upper abdominal symptoms can indicate stomach cancer, pancreatic cancer, or liver cancer. Here's why. Stomach cancer causes early satiety, feeling full after eating small amounts because the tumor takes up space in the stomach. It causes persistent indigestion and discomfort. Pancreatic cancer growing in the head of the pancreas causes vague upper abdominal pain that may radiate to the back. Liver metastases from any cancer cause right upper quadrant discomfort. These symptoms are particularly insidious because they're vague and easily attributed to benign conditions like gastritis, peptic ulcers, or simple indigestion. Many people self-treat with antacids for months before seeking care. Research from the American Journal of Gastroenterology examined presenting symptoms of stomach and pancreatic cancers. Studies found that persistent indigestion, early satiety, and vague abdominal pain were present in 60 to 70% of patients for an average of 6 months before diagnosis. What makes these symptoms concerning is their persistence despite treatment. If you take antacids for weeks and symptoms don't improve, or they improve temporarily then return, this warrants investigation. Progressive symptoms, gradually worsening over weeks, are more concerning than stable symptoms. What you must do is seek evaluation, including upper endoscopy to examine the stomach and imaging of the abdomen with CT scan to evaluate pancreas and liver. Sign number 3. Skin changes, including new moles, changing existing moles, or non-healing sores. Skin cancer is the most common cancer, with risk increasing dramatically after 60. Melanoma is the deadliest skin cancer. Warning signs include new moles appearing after age 60, existing moles changing in size, shape, color, or texture, moles that bleed or itch, and sores that don't heal within 3 weeks. Research shows melanoma incidence increases exponentially with age. 5-year survival exceeds 95% for early melanoma, but drops below 25% for metastatic disease. What you must do is perform monthly skin self-exams looking for concerning changes. See a dermatologist annually for full body skin exams. Any suspicious lesion should be biopsied. Sign number 2. Persistent pelvic pain, bloating, or urinary changes in women. These vague symptoms can indicate ovarian cancer, often called the silent killer because symptoms are subtle. Ovarian cancer causes pelvic or abdominal pain, persistent bloating, feeling full quickly, and urinary urgency or frequency. Research shows most ovarian cancers are diagnosed at advanced stages because symptoms are dismissed. If these symptoms occur daily for more than 2 weeks, seek evaluation, including pelvic exam, transvaginal ultrasound, and CA-125 blood test. Sign number 1. Any persistent symptom that doesn't resolve within 2 to 3 weeks. The most important warning is trusting your instinct. If something feels wrong, if symptoms persist despite over-the-counter treatments, if you're just not feeling right for weeks, seek medical evaluation. Better to check and find nothing than delay and find cancer too late. Which warning sign surprised you most? Have you experienced any of these symptoms? Share in comments. If this information could save a life, please share this video and subscribe for more evidence-based health content that could save your life or the lives of people you love.